Hi, my name is Brittany Antion, and I am presenting my capstone presentation for Nursing 4741, my last class for the BSN program. And my topic today is preventing falls in the post anesthesia care unit. I currently work in the post anesthesia care unit, and I have for almost a year now since graduating with my RN degree. And I love this unit. I chose this topic because I believe that there are multiple falls that occur. We don't have many falls in our unit specifically, but I see a lot of opportunity for falls working on this unit due to the increased dosages and medications that are given to patients that paralyze and distort the way that they think at the time. Falls can be prevented. A lot of times, keeping the nurse at bedside. When we get really busy in our unit, we tend to have family at bedside often because it's outpatient surgery. So, educating the family members and just making sure that they understand the amount of medications that the patient had. Um, a lot of family members think that it's funny because the patient is slurring their words and can't stand up straight. They want to record them. We really try to encourage them to assist them and take it seriously because of the effects that falling could have on the patient after their surgery. Staff needs to be aware of this and does need to be observant of how the patient acts or the family members act. If you feel like the patient isn't stable enough to get themselves ready, then the nurse should stay at bedside and help to prevent those falls. Um, we do have a specific discharge criteria that patients are required to meet to determine their status as far as discharge. So we like them to be able to sit up and stand on their own, as well as tell us who they are, when their birthday is, what year it is, where they currently are, their family member that's at bedside. We want them to address them, know who they are, as well as eating. We do have them start a liquid diet while they are in the post anesthesia care unit with us. And we keep them for a minimum of 30 minutes and usually up to 2 hours. Sometimes more if needed. It just kind of depends on that. The patient is evaluated by a registered nurse prior to going home, and then they're evaluated again by an anesthesiologist. At that point, if they've been discharged by anesthesia, then they are good to get dressed and get ready to head home. There is a risk of long term injury if a patient falls in the post anesthesia care unit or any unit. And that is very important to stress to the family members whenever they are taking that patient home to take care of them. A lot of times, these patients have to go home and they're being cared for by only their family members. And you just want to stress the importance of preventing those falls once they are home as well. 1 out of 5 falls can cause a serious injury per CDC in 2022. Most falls can be prevented with proper education to staff and family members, and staff is the one that needs to be providing that education to family members and the patient prior to their discharge as well. Again, stress the importance, let them know the altering effects that these falls can have on this patient after they go home. Anesthesia does a little bit of background on preventing falls for this is that anesthesia can cause lightheadedness, lethargia for up to 24 hours. So, on our discharge criteria, we do make sure to stress to the patients that for 24 hours they are not to drive a car, operate heavy machinery, no lifting or straining for the next 24 hours, no alcohol or sleeping pills due to increased lethargia already, as well as we don't want the patient to be alone for the next 24 hours. So when they get up to walk around, get up to go to the restroom, we do stress to the family that they do need to be there present with them so that they don't fall once they've gone home or while on the unit as well. When they're on the unit, if they're having to wait an extended amount of time for discharge, we do give them a call light. And we do keep our bed rails up in the post anesthesia care unit just to let them know if you need to get up, please call us and let us know. As far as family members being at bedside, they're always at bedside with the patient once they come out of surgery, but we do ask them to let the nurse be there when the patient gets up for the first time. We also will evaluate the patient's orientation prior to them getting up. A lot of patients come out of surgery and they're needing to go to the restroom or they're wanting to get up and get dressed right away. We do make them wait until anesthesia has signed them out and cleared them for discharge just because we don't want to increase that risk of fall. usually anesthesia will not sign them out if they're not good to stand up and walk around. So at that point, that kind of lets us know as the nurse that they're not ready to get up and walk to the restroom either. We do have alternatives for that, but that's the safest way to help prevent falls in our unit, and it's been working great for us so far. Again, like I said, we do assist with the first time standing up post-op as well, even with the family at bedside. So for my picket statement, it was in the post-anesthesia care unit, how can medical professionals decrease the risk of falls by supervising the patient while they get dressed, as well as educating the family at the importance of fall prevention compared to leaving the patient unattended without educating the family? How does this affect patient fall rates? For my literature review, I do have multiple articles. One of them states, Cutler 2017, that inpatient falls and injury incidents varies according to unit characteristics. So if you don't have a lot of staff in a post anesthesia care unit, they're going to be at an increased risk of falling, obviously. So we do want to prevent that the best that we can. If we're busy that day or short staffed and we have multiple nurses per patient, we do leave our bays open. A lot of times we'll close the curtain, provide privacy for the family and their patient, but we do need to have eyes on them at all times. So if we have 2 or 3 patients that we're trying to recovering within a 30-minute time range, we will leave those curtains open and stay right next to that bay. That way we can see or hear if anything is happening and we need to step in. Medications drastically increase the risk of falls, and education on that is very important, as well as the nurse knowing that they need to monitor that patient more closely due to the increase of medications and the amount of medication that they received during their procedure. Altered mobility is due to that medication as well as paralytic medications. A lot of the times, patients are paralyzed from the waist down. They will have a spinal, a block to either the right or left leg or both legs if needed, if they're getting a total hip or an amputation, anything like that. So we do have criteria as well that we will go through to ensure that that spinal has completely wore off prior to them discharging or even getting up for the first time. When they've had a spinal, we do have PT come down and evaluate them and get them out of bed for that first time. A lot of patients, they don't want to have to wait for that, but we do stress the importance of preventing any kind of falls or injury, as well as stressing that to the family, because a lot of times they don't understand why they can't just get the patient up and walk them around or take them to the restroom. So letting them know the dangers from the medications that they've received is always helpful with that as well. They also have altered mobility due to the narcotic medications that they receive once they come out in the PACU unit. So not only are you waiting for those medications they received in the OR to wear off, you're also waiting on the medications that they've received with you since you've gotten them to wear off. If they woke up in pain and you had to give them any kind of pain medication, in our unit we give fentanyl and Dilaudid IV very often. So we will keep them for a minimum of 30 minutes after they've received that medication from us. This also decreases awareness in the patient. So a lot of times they may be trying to rip off their monitors, get out of bed, walk on their own, and they're just not aware of that. So staying at the bedside with them is definitely a priority on this unit. Specific criteria, again, like I said, needs to be met prior to them discharging, as well as them standing on their own without falling, being alert, aware, oriented to their surroundings. You don't want to send them home if they're not aware of what they're doing whenever they get up and move around. You do want to look at, whenever you're trying to prevent these falls, what's causing this increased risk of falls. So if we were having an increased risk, would it be that the nurse isn't at bedside? Maybe the patient's being discharged from anesthesia too soon and they're not staying long enough. Maybe with the amount of medications they're receiving, they need a longer evaluation prior to getting up and being discharged. Education is always key. You want to educate staff, family members, the patients, anybody that's going to be around that patient that can help prevent those falls. It is always good to track performance to determine the protocols that are currently being used to prevent falls prior to starting new education on this as well. Daily education on fall prevention and morning huddles is a great way of reminding nurses, hey, we want to educate today, educate the family, educate the staff members, prevent those falls. Implementing fall improvement programs is also really good. That's from an article written by Insuk in 2020. He talks specifically about implementing fall prevention programs, as well as backtracking and making sure that the fall prevention techniques that you already have are being implemented, because a lot of times those aren't being implemented on the floor at all, and that can really help with preventing falls. my proposal plan would be to educate staff daily on fall prevention. Like I said, morning huddles, it's just a quick reminder, hey, you're going to teach your patients, your staff members, anyone around you, your tech, if your tech is helping your patient get dressed, their family members, the importance of waiting for that nurse the first time to get up or waiting for that tech, and monitoring and just making sure that they're not going to fall when they get up. Having staff educate those family members prior to them getting dressed as well. So it's good. They've got a lot going on. Their family member just had surgery. The patient doesn't remember anything that's happening. Just kind of remind them when they're starting to get ready, hey, you don't want to bend over and put your shoes on. Hold on to their hands. They need to take it easy. As well as standing there when they do stand up for that first time with the family member, you don't want that to be their responsibility. So you want to stand there and make sure they're pretty stable to get ready. For dissemination, I do have that fall prevention can be implemented as continuing education as well. I think that outpatient classes prior to surgery will be a great intervention to kind of let the family and the patients know what to expect after surgery, post-op, and whenever they go home, as well as they're not going to have all those medications whenever you're doing that teaching if they come in before surgery and learn everything they need to know about fall prevention. There are many community-based organizations per the CDC as well that you can take to read up on fall prevention if you know that your family member is going to be having surgery and you're going to be the one caring for them. And again, education for that staff and those family members. For my summary, there are many factors that come with preventing falls. It takes a village to keep your patients from falling whenever you're on a unit, especially whenever you're short-staffed, which has been occurring a lot lately. Um, educate, question those family members and caretakers. If you feel like they're not capable of caring for the patient, it's your responsibility as the nurse to pass that upward so that maybe that patient needs to stay in the hospital for the next week until they've recovered well enough to go home and take care of themselves, as well as making sure they're able to stand and ambulate on their own. You also want to make sure, a lot of nurses try to race those patients out the door because we're short staffed and we have them just rolling out of OR back to back. You want to make sure that they properly meet that discharge criteria prior to leaving, because if they do have a fall or an injury within 72 hours of discharge, that does fall back. It can fall back on that RN depending on how it was encountered. Thank you very much for listening to my presentation today.